Hello friends, welcome back to Law Bits for Seniors, your go-to channel for essential legal and financial planning tips to make your golden years truly golden. Today, we are tackling a subject that affects every retiree, Medicare. I know Medicare can seem complicated at first with all its different parts, rules, and jargon. But our goal today is to break it down into simple, easy to understand pieces. Understanding your Medicare options is incredibly important for having the coverage you need in retirement. First, let's talk about what Medicare is. It's a federally funded health insurance program mainly for folks 65 and older. Think of it as your healthcare companion as you sail into retirement. There are several parts to it, each covering different services. We have Medicare Part A, the part that covers your hospital needs. This includes your hospital stays, skilled nursing care after a hospital visit, some home health care, and even hospice care if you're terminally ill. Inpatient hospital care. If you have to stay in a hospital, Part A covers you for up to 90 days. You also have an extra 60 reserved days you can use in your lifetime. Skilled nursing care. After a hospital stay, you might need extra care like medications or wound care. Part A covers this for up to 100 days, but only if you spent at least 3 days in the hospital before. Home health care. If you're stuck at home but still need some skilled medical care, Part A has got you covered. But again, you need to have spent at least 3 days in the hospital recently to qualify. Hospice care. If you're terminally ill, Part A will cover your hospice care for as long as your doctor says you need it. Now, it's crucial to know that Part A does offer some long-term care coverage, but it's very limited and comes with strict conditions. You'll also have to chip in for some of the costs like deductibles or co-payments. Because Medicare Part A won't cover all your long-term care needs, you may want to look into other options like Medicaid for that. Now let's talk about Part B, which is all about outpatient services. This part covers your outpatient medical care like doctor visits, preventive screenings, lab tests, medical equipment, and some prescription drugs. Part B has you covered for things like medically necessary services from licensed providers, including doctor visits in the office or hospital. Durable medical equipment, walkers, wheelchairs, oxygen from Medicare-approved suppliers if your doctor says you need it. You can purchase or rent. Home health care like nursing or therapy if you are homebound and need skilled services. Ambulance transportation for emergencies, and some non-emergency transport if medically necessary. Preventive care like cancer screenings, vaccines, annual checkups. No coinsurance for most preventive care, which is great. Outpatient therapy services like physical, occupational, and speech therapy. X-rays, MRIs, and lab work ordered by your doctor. Limited chiropractic care for spinal manipulation. Certain prescription drugs that are typically administered by a physician. This covers a lot of the medical care you'll need outside of hospital stays. But remember, you'll likely share some costs through deductibles, copays, or coinsurance. For 2023, the Part B deductible is $226 per year before coverage kicks in. That means that after you cover the first $226 of the cost, you typically pay 20% coinsurance for Part B services. So budget for some medical costs in retirement in addition to your Part B monthly premium. Now we come to Part C and D of Medicare, which are provided by private insurance companies. Part C plans are known as Medicare Advantage plans. Imagine Medicare Part C as a bundle package, like when you get your TV, internet, and phone service all in one. It includes everything from Original Medicare, which is Part A and Part B, and sometimes even adds extra services like vision, dental, and prescription drug coverage. The great thing about Medicare Part C is that everything is streamlined into one plan with one card you carry. It is offered by private insurance companies, which means you have more options to choose from. However, these plans have networks. You generally need to use doctors and facilities in their approved network except for emergencies. This helps keep overall costs down. You still have out-of-pocket costs like copays and deductibles, but typically less than Original Medicare since it's all bundled together. Finally, we have Part D for prescription drug coverage. This helps pay for your medications at the pharmacy. Again, Part D plans are offered by private insurers who negotiate costs with pharmacies. Each has a list of covered drugs called a formulary. You can either get Part D as a standalone plan to complement your original Medicare, or as part of a Medicare Advantage plan that includes drug coverage. It's essential to choose a plan that covers the specific medications you take, so make sure to check the plan's drug list before signing up. Part D plans have monthly premiums and cost sharing that varies by plan. Compare plans closely for the best value based on the medications you take. Here are some key points on Medicare enrollment. First up, there's the initial enrollment period you should be aware of. Picture this as a special 7-month window that opens just for you. It starts 3 months before the month you turn 65 and closes 3 months after your birthday month. So if your birthday is in June, your window opens on March 1st and closes on September 31st. Why is this window so important? Well, if you miss it, you could end up paying more for your Medicare coverage in the form of late enrollment penalties. Plus, your coverage could be delayed, leaving you without health insurance for a period of time. Now, what if you already have health insurance, maybe through your job? Good news! You might be able to postpone enrolling in Medicare Part B and Part D without any penalties. But, and this is crucial, you should double check this with the person who handles your work benefits. They'll give you the specific details on how your current insurance works with Medicare. After initial enrollment, you can make changes during the annual open enrollment period from October 15th to December 7th each year. During this time, you can make changes to your Medicare coverage that will take effect on January 1st of the following year. You're not locked into one plan forever, you have options. You can switch between original Medicare and Medicare Advantage plans during this period. So, if you find a plan that better suits your needs, this is the time to make that change. Let's start with Medigap plans. Think of Medigap as your safety net that catches what original Medicare doesn't cover. It helps pay for things like copays and deductibles for Medicare Parts A and B. Imagine you have a bucket with holes. Medigap is like the extra layer at the bottom that catches any water that slips through. However, it's important to note that Medigap doesn't cover prescription drugs. So, if you need medication, you'll have to look elsewhere for that coverage. Next, we have Medicare Advantage plans. We discussed Medicare Advantage as Part C previously. Picture this as your all-in-one toolbox. It includes everything that original Medicare offers and usually adds extras like prescription drug coverage, vision, and dental. The catch? You'll need to use doctors and hospitals that are in the plan's approved network, kind of like shopping at a members-only store. So how do you choose between Medigap and Medicare Advantage? It boils down to 3 main things. Budget. How much can you afford to spend on healthcare each month? Health needs. Do you need prescription drug coverage, or are you looking for basic medical services? Doctor access. Do you have a preferred doctor or hospital you want to continue seeing? How about long-term care? While Medicare provides valuable medical coverage during your retirement years, one major gap is its limited support for long-term care. Things like nursing home care and home health aides are not covered for extended periods of time by Medicare. That's a significant gap, considering long-term care is the largest medical expense many people face during retirement. If you want a stress-free strategy for long-term care, you may want to consult an elder lawyer to explore other options like Medicaid planning before it is too late. An elder lawyer can help you navigate the intricate paths of healthcare in retirement and help ensure you're protected against the huge costs of long-term care. That way, you can focus on living your life, not worrying about medical bills. Let's recap the Medicare essentials. Medicare has 4 parts. Part A for hospital care, Part B for outpatient and doctor visits, Part C for Medicare Advantage plans, and Part D for prescription drugs. Enroll on time when you turn 65 or risk penalties. Supplement with a Medigap or Medicare Advantage plan to reduce costs. Know that Medicare doesn't cover long-term care for extended time periods. Consult an elder lawyer to prepare for the potential cost of nursing home or home health care. Part A covers some skilled nursing and home health care, but only for limited days and after a hospital stay. Don't rely on Medicare for ongoing care needs. So there you have it. A simple guide to understanding Medicare. If you found this video helpful, please like, share, and subscribe to Law Bits for Seniors for more invaluable insights into retirement living. And if you have any questions or would like to schedule a consultation, please reach out to us through the contact information provided in the description below. Take care, and let's make your retirement not just good, but great.